Hi, I'm Dr. Seema Sharma, and by today's video, I want to discuss a very common question a lot of pregnant patients ask me, that is, Doctor, what is the right time to go to the hospital for delivery? Now, the answer is not very simple. It is not that XYZ and you go. Well, there is one called a very emergency admission. That is, if you feel that the baby is not moving so well, even if it is a wrong hunch, please proceed to the hospital for checkup, especially towards the very end. Second, if you start leaking, by leaking I mean you start having very thin discharge, which is not urine, through your vagina, and something is wrong. And especially if the color of this fluid that you are discharging from your private parts, that is greenish in color, that is really an emergency to reach the hospital. Or God forbids, if you have fallen down, you have hurt yourself, you have started unusual bleeding anytime in your pregnancy, these are a few flag signs. You must reach the hospital or talk to your healthcare professional. Now, that aside, there is a routine admission for delivery in the hospital. And a lot of people worry that will they be able to reach the hospital in time or not. Well, believe me, nature gives you more than enough times, and the stories that you hear from other people that, oh, my delivery happened in 30 minutes, those are unusual and usually made up stories, and you will hear it from adults who have delivered 50 years back and they have actually forgotten their timeline. So these kind of things really almost never ever happen. So you will have enough time to reach the hospital. And one very important thing I keep telling everybody is get to know your body. By that I mean keep feeling your tummy often. When you are pregnant, you would feel that the uterus gets hardened at certain times, and then certain times you would find it relaxed. Now these are normal Braxton Hicks contractions, and nature usually makes it like a trial run, like we run a race, and before that we want to warm up and come back before we run the actual race. The same way uterus does the same. There are contractions which happen, it contracts, relaxes, contracts, relaxes, but usually it is not associated with pain. Now towards your delivery date, as it comes closer, you would find that these Braxton Hicks contractions are getting painful. And a good time to know is you put your hand on the tummy, you feel the hardness coming along with pain, start noticing it. Time your contraction, how long does the pain last, and after how many minutes it comes back again. If it is a genuine labor pain, you would find that the intensity of pain is increasing gradually, and it is coming, say earlier it was coming once in 30 minutes, and then you would find it is coming every 20 minutes and then every 15 minutes, like that. So a good time to come to the hospital is when pains have established nicely and you have monitored it over 2 hours, and these pains have established, they're coming once in every 10 minutes. And if it is a first delivery for you, wait for it to come at least 2 times in 10 minutes, each lasting for at least 20 seconds. That's a good time to proceed to the hospital. Unless these are emergency signs that I just mentioned, unless you have any of them, just go anytime. But if you have none of them, baby is healthy, you have not been warned by your doctor that you need to report early, wait for the labor pain to establish, because if you go very early on in the labor, yes, chances of cesarean sections go up. So try and have little pains at home, let it establish, and then once you are having one pain or two pains in 10 minutes, each lasting for 15 to 20 seconds, that's a good time to come to the hospital. And also a lot of people, especially for the first time, they would have a mucus plug which is expelled, which we call in medical terms as show. If you imagine your uterus like a balloon, it's the mouth of the balloon. When it loosens up, there is a plug which is like a cotton ball, which the nature had inserted to kind of keep the infections away. So when that is expelled, that's another sign that cervix is loosening up, but that's not really an emergency sign for admission, because labor pains can take up to a week after this expulsion to set in. So keep doing your exercises and wait for appropriate time. Don't just jump at the first hint of a pain that, okay, now it's the time to go to the hospital. Please wait, keep monitoring your baby's movements, Note down your pain's frequency and intensity, because genuine labor pains have a rhythm to it. Usually, if you have false labor pains, which is like a false alarm, you would find in 1 hour there were 6 pains, and the next 6 hours there were no pains, and you slept. Yeah, but then that should up your antenna that labor is round the corner. But genuinely, please wait for labor pains to get established before you reach the hospital. This will reduce your hospitalization time. It will also reduce your anxiety, the anxiety of your relatives and your healthcare personnel, because once you reach the hospital, the countdown begins, and then everybody starts asking the doctor, now how long, doctor, how long. Just give nature its due time. Watch and come to a hospital when labor is nicely established. Thank you so much.